What a blessing to be here. What an honor, what a privilege to be here at American Public Health Association. Yes, we're here in Denver, Colorado. 138 years of struggle. 138 years of bearing witness, trying to keep alive the banner of public life in a nation obsessed with private sensibilities and material toys and titles and honors. But you represent America at its best. I pay tribute to you. You constitute part of the glue that holds the fragile experiment called the U.S. democracy together. You really do. You constitute part of the leaven in the democratic loaf that allows it to expand. I want to begin by acknowledging my dear, dear brother who spent so much of his time and energy, so many years of his life. My dear brother, Dr. George C. Benjamin, Executive Director. I want to salute you, my brother. I want to acknowledge Sister Yvette as well in Washington, D.C. I want to acknowledge my dear sister. We spent time in the same city, Sacramento, California. Not a city known to be on the cutting edge, but I love Sacto. I love Sacto. I love Sacto. But Dr. Carmen Neverez spent a little time in Sacramento, graduated from high school there. St. Francis, I graduated John F. Kennedy. I want to salute her. She is your president. Give her a hand. Give her a hand. Absolutely. Love my dear sister. And Assistant Secretary for Health, my dear brother, Dr. Howard Cole. We spent time together both in Cambridge, and he's a Yale College, Yale Medical School graduate. And I was first tenured at Yale, so I shall forever be thankful to Yale University. Give him a hand. Assistant Secretary for Health, dear brother Howard Cole. And then there is the legendary Professor Bill Jenkins. What can I say? Words fall short. And I'm sure you heard his message. He is still on fire for justice. And it's a beautiful thing to see someone so intellectually sophisticated and empirically oriented to still be on fire for justice. It's not in any way oxymoronic to be in high places, to engage in the most abstract formulations and refined interpretations, but keep your eye on those sly stone called everyday people. Oh yes, those the late great James Cleveland called ordinary people. Oh yes, we love you, brother Jenkins. Give him a hand, Professor Bill Jenkins. Give him a hand. We love you, brother. Been at it a long time. My dear sister Lois Capps, going at it in Congress, and that's so very difficult these days. Oh my God, I don't know about you, but we in such deep, deep trouble. And anytime I see a congressman or woman still associated with the American Public Health Association, concerned about justice, I feel inspired. Give her a hand, give her a hand. Last but not least, there is a brother in our midst. He's the grandson of one of the greatest scholars, one of the greatest freedom fighters produced in American civilization. I'm talking about W.E.B. Du Bois. He's the grandson of W.E.B. Du Bois. Please stand, Brother Arthur McFarlane. Where are you? Where are you, Brother Arthur? There he is. Put the cameras on this brother. Put the cameras on him. Look at his heart, his mind and soul, and see Du Bois and A. Philip Randolph and Fannie Lou Hamer and Ella Baker and Martin King and Rabbi Abraham Joshua Heschel and Dorothy Day. I have to call the roll. I'm sorry about that, brother, but every time I hear the word Du Bois, I'm on fire. And then when I see the connection through the flesh here in Denver, of all places, way up high in the sky, a mile high, yes, indeed. No, we love Denver. We love Denver. Yes, we do. Yes, we do. But I'd like to say something that not only empowers and enables you, but I also want to say something that unnerves and unhouses you, because we live in times in which we must put the accent on courage. Need courage, too much apathy, too much complacency, too many folk well adjusted to injustice. Too many folk well adapted to indifference. That's why I begin on a Socratic note. To talk about the public health imperatives connected to social justice means bringing in the grand example of Socrates in line 38a of Plato's Apology: the unexamined life is not worth living. And I can hear Du Bois in the background: the examined life is painful. Learning how to cut against the grain, to wrestle with the most fundamental and terrifying questions that any one of us have to come to terms with, beginning with that question of what does it mean to be human. The Greek actually says in line 38a of Plato's Apology, the unexamined life is not a life for the human. And our English word human derives from the Latin humando. Humando means what? Burying. And burial, that's where our word humanity and humility come from, being tied to the earth and the soil, unpretentious, willing to tell the truth, and acknowledging the condition of truth is to allow suffering to speak. There is no serious talk or engagement with the truth about our lives, individually, collectively, nationally, or globally, without allowing suffering to speak. All the priceless and precious ones, no matter what color, no matter what civilization or sexual orientation, allowing their voices to be heard so that their wounds and their scars and bruises can be transformed and transfigured into a voice that helps us determine our democratic destiny. That's what we're talking about. That's what we're here. That's what I'm here for. So what is that fundamental question? Was the question, what does it mean to be a featherless, two-legged, linguistically conscious creature born between urine and feces? That's who we are. Put on my three-piece suit if I want to. Talk about my Harvard degrees and Princeton degrees. If it wasn't for my mama's love push that got me out, I wouldn't be here. I am who I am because somebody loved me, somebody cared for me, somebody attended to me. And one day my body will be the culinary delight of terrestrial worms. Just like yours, unless you're up for cremation. So the fundamental question in talking about justice is, what kind of human being will you choose to be? What kind of virtues, what kind of character, what kind of values do you want to exemplify in your life so that when they look for you in the coffin, they can say, she lives a life with Socratic energy. She mustered the courage to raise deep questions, to interrogate certain assumptions and presuppositions. I tell my classes at Princeton all the time, when you come to my class, you learn how to die in order to live a more decent, compassionate, critical, and healthy life. One of the great paradoxes of a healthy life is learning how to die. What the Greeks call paideia, P-A-I-E-D-I-A, paideia, not just schooling, deep education. Deep education, and you learn how to die by what? Calling into question those assumptions and presuppositions, those dogma and doctrine that impede and obstruct your ability to flower and flourish. And we know the history of America has been one that we were locked into certain dogma. Dogmas like white supremacy. Brother said people want to use the word racism. I talk about the vicious legacy of white supremacy. That's what it was. That's what it continues to be in new forms. There's dogmas of male supremacy. There's dogmas of Gentile supremacy vis-a-vis our Jewish brothers and sisters. Dogmas of Protestant supremacy vis-a-vis our Catholic brothers and sisters. And there was dogmas of unfettered markets, unregulated markets, that somehow the invisible hand of free markets would generate a healthy public life. Well, the history of public health in America is the history of a sick market. It doesn't deliver based on sheer, unfettered, unregulated markets. It's sick. Something else needs to intervene. We're not trashing markets. We're being Socratic in questioning certain dogmas that out of deliberate ignorance and willful blindness don't allow us to keep track, especially of the least of these, especially of our poor brothers and sisters of all colors. Our red brothers and sisters, let us never forget our indigenous brothers and sisters.